Hello, everybody. It's Medical Monday. I'm just going to give y'all a few minutes to hop on. Having some ring light issues back here. So it is May, which is Mental Health Awareness Month. So all month, every Monday, I will be talking about something regarding mental illnesses. And so today, my goal is to talk about depression and suicide awareness. So we'll give a couple more minutes for a couple people to jump on. Okay. I'm having some issues with this here. All right. It might cooperate, it might not. Okay. Well, I'm going to go ahead and introduce myself for those who do not know me. My name is Valia Sutton. I am a board-certified family nurse practitioner who saw where the community was lacking education in regards to basic health education. So I decided to start Your Friendly NP, where I come on live and I just give you guys a glimpse into whatever I decide to talk about every Monday. I do take some breaks, but I am on YouTube as Your Friendly NP, also Instagram as Your Friendly NP. I do have a Facebook page and a Facebook group, all Your Friendly NP. So the Facebook group is just for women only at this time. So I do encourage you guys to join this group. But like, follow, share. If this is informative for you or good for you, please go ahead and share this. It can help somebody else. And I'm going to do something different. I usually don't do like a PowerPoint or presentation. I usually kind of just talk. But today I actually created a little PowerPoint. It's nothing fancy. But that way you guys can see what I'm talking about. Of course, if there are any questions, please post them. StreamYard wants you to go through Facebook and actually give them privileges to show your name. So if you will, there is a link on the page that shows you where to click and approve, give them permission to post your name. So that way, when you post a comment or a question, I can see who you are. If you don't do that, it just shows up as Facebook user. So take a couple seconds if you don't mind, or if you think you're gonna have a question, to go on and give them permission. So I'm going to go ahead and share my screen with you guys and see if you guys can see this PowerPoint. Again, today's topic is going to be depression and suicide awareness. Okay. Bear with me with the screen. Go ahead and share this here. All right. Okay. I hope you guys can see this. I'm going to go ahead and start. Make sure. Give me 1 second. All right. So we'll go ahead and get started. Again, depression and suicide awareness, with this being Mental Health Awareness Month. Of course, depression is one of the biggest mental illnesses that a lot of people deal with, and some are dealing with it and don't even realize that they're dealing with it. But depression is something that can cause some issues long term with you guys. Like if you're constantly battling with depression, this is going to be something that you want to get treated. Give me 1 second. Let me see. I guess we're having some issues with the PowerPoint. Hey, Quita girl, welcome. Hello, Jalen. Yes, anxiety is a big mental issue that I'm going to deal with next week. But today is going to be depression and suicide. But yes, anxiety is also something that a lot of us deal with. I am working on trying to share my screen with y'all. Let me see. This is new, so bear with me. And of course, I'm texting my family to see if they can see it. All right. I am not tech savvy. Trying. Okay. So apparently you guys can see it now. So I'm gonna go ahead and get started. So again, depression and suicide awareness was created by me, your friendly MP, also known as, or best known as, Valia Sutton. Again, I am a board certified family nurse practitioner. So who's at risk for depression? I mean, anybody. But the ages that we typically start seeing depression is your adolescence, early adulthood, which basically is when we start having real stressors. I mean, we're out here, we're living life, we're really adulting. So this is kind of where the brain begins to shift, because stress is something that can cause this shift and lead to depression. If you have a first degree relative, so somebody like your mom, dad, sister, brother who's dealt with depression, this increases your risk of developing depression. However, you can be diagnosed with depression without actually having somebody be diagnosed as a first degree relative. So you could have a family who's never had any mental illnesses or mental health issues, and then you could be the first. So it does not have to be a family member that has had it. You can still develop it. They have also seen that women are more likely than men to show these depressive symptoms, but really, I think it's just women are more likely to talk about it. Men don't really go to the doctor. So, of course, if you know that male friend or that uncle, brother, cousin that when we discuss these symptoms in the upcoming slides, if you know anybody dealing with this, of course, encourage them to reach out and talk to somebody, because depression is real. And I mean, stress is a silent killer. I know you guys have heard that, but it's true. The elderly can also have an increased risk of depression. If you can imagine getting older, you have people, you're losing loved ones around you. Life pretty much is slowed down for some of the elderly patients. They end up being diagnosed with these diseases like Alzheimer's or Parkinson's, seizures, histories of cancer or chronic pain. So that increases their risk of developing depression. It is still treatable despite the age. So definitely watch out for that in your elderly family members and friends. Certain life events, of course, this is just, it makes sense. If you have traumatic events, death, taking care of parents, or any loved one, lack of support or help, finances. Finances is really big on stress, especially in the young adult age bracket. I'm sure it affects everybody else, but in the 20s, like they tell you, trying to make up for whatever you've done in your teens, so now you're trying to make up for everything and catch up. And so it causes a lot of stress. But just learning how to cope with those stressors can help prevent the depression from worsening, taking you to a dark place where you feel like you can't get out. So to clinically diagnose depression, of course, you want to treat the patient. As a provider, we're supposed to listen to our patients and treat our patients. But per the book, you're supposed to have 5 out of 9 symptoms for at least 2 weeks to be clinically diagnosed. So if you're somebody who has issues with sleeping, you say you usually love to get out and do some yard work, and it's been 2 weeks and you don't even want to touch the grass or flowers. If you're feeling guilty, some people feel worthless and hopeless, very tired all the time. Your energy used to be somebody who could get up and do, go about your day very early. Now you drag. Some have issues with concentrating or having trouble, like if you're in class, difficulty paying attention. Some have weight changes. Some lose weight. Some gain weight. Just kind of depends if they're a stress eater, if they're eating or not eating at all. And psychomotor agitation is just anxiousness, like, just constantly biting on the nails, just nervous, like they say, nervous Nancy, just somebody who's just kind of all over the place, seems always on edge. But And they say 9. So so the 2 at the top is a depressed mood or loss of interest, along with the other 7. So that's the total of 9. So again, disclaimer: I am not diagnosing anybody or trying to treat anybody via live. But if you feel like this lines up with you, then definitely be seen. And your primary care doctor, you don't have to see a psychiatrist to be diagnosed with depression. It is good to have a therapist on top of, like with medications. If you have to go the medication route, both work really well together. And I think I'm getting ahead of myself, but I do know once you treat a patient, so if you're on antidepressants and you're treating a patient for at least a year, they say give it a year. And that is where you can probably try to start weaning off. But in the meantime, you can see a regular provider. It does not have to be a mental health specialist or a psychiatrist or behavioral therapist. You can go be seen with just a regular family practitioner or family doctor. Okay. Could something else be wrong? So yes, you can have some out of whack lab work. So your CBCs kind of check your blood counts without trying to be so scientific and technical. You have electrolytes in your body. Your blood levels could be off. Vitamin deficiencies. Vitamin D is a big one, and I failed to put that on here. And again, I've talked about this before, and I'm really big on vitamin Ds. Please get your vitamin D checked. A lot of providers are not drawing vitamin Ds because insurance companies don't pay for it unless they say they can figure out a reason why. But the reason should be, depressed mood. So your doctor or your provider, they know what to put in for you to get these things covered. But the bottom line is fight for your labs to be checked. You can fight for your vitamin D. Always ask, are you checking my vitamin D? Of course, this isn't something you need checked every single time you go to the doctor, but it's good to know, especially if you're someone with darker skin. We don't absorb sunlight very well. So we typically have a lower vitamin D, and that vitamin D level being really low can throw off fine. So they do correlate. They go together. So I do recommend if you go and get basic blood work, just ask about the vitamin D. Even if you get it checked once every 6 months, that's something. And vitamin D is over the counter. So a lot of things that we go through, we can easily put back in our diets or take a supplement just to help get everything balanced. So LFTs, that's going to be like your liver function. Your CMP is going to be your electrolytes. B12 is going to be more your energy, your vitamin dealing with energy. So yes, you can have a deficiency in all of this. Your TSH is going to be your thyroid. Thyroid can definitely mimic depression if you're having some issues with it being too low or too high. So lab work, please get it checked. If you're like, I was fine last month and now I'm like, something's going on, then get yourself checked out. Could just be something acute, which simply means something just happened, not anything long term. And if I can't see any questions right now, so bear with me. Once I'm done with this, I'll pull back up the screen so I can address any questions or concerns. Okay. Your SSRIs. So this is going to be the provider's go-to medication. This is going to be one of the first things that they pick for depression. It's a low risk for overdosing because of, again, with depressed patients, you do have that risk of suicide. Of course, we don't want to give anybody anything that they can potentially overdose on. Side effects are very minimal. You do have some. All meds have some side effects, so you do just want to watch out for certain things. And I don't want to make this about pharmacology today, so I'm not going to get into exactly everything with the SSRIs, but I just wanted you guys to see a list of the most common medications that you may have seen or you may be taking. Now, just FYI, Prozac is one of the best SSRIs when it comes to compliance. If you're somebody that you will take a medicine Monday but forget Tuesday, Prozac may be something you request because it has a longer half-life, which means it stays in your system longer. The risk for SSRIs, if you stop them abruptly, so just say you wake up one day, you're like, I don't want to take this anymore, then you are at risk for those withdrawal symptoms. So anxiousness, nausea, vomiting, sweaty. Be very careful just stopping meds. Any med, doesn't matter if it's an SSRI or not. Any medications without discussing it with your provider, because what happens is your body has to ultimately try to get rid of Like it's just trying to make up. It's missing something because it's used to taking something every day. But you want to make sure that you are mindful when you decide, like if it's too strong or if the side effects are too bad for you, or if you just don't feel right on it. Communicate that with your provider as soon as possible so that they talk to you about how to taper the drug or basically discontinue the drug, but do it the right way. Okay. So yes, there are withdrawal symptoms with stopping these medications. Just you wake up one morning and stop it so abruptly. Paxil is when they say Pax on the pound. So be careful if you are a little cautious about weight gain. Some may try to prescribe it, and you can try it and see. But I do know that Paxil is one that can cause some weight gain. Zoloft is usually our first one. Sertraline is usually the first one we usually try to go to. Very minimal side effects, and you guys may have heard of that. But this is just a minimalized list. So there are definitely more SSRIs, and I have no idea what I just did. Oh, okay, sorry. This is just a short list. This isn't everything, but these are probably gonna be the most common that you see. Okay, and another thing with taking these meds for depression, it just takes time. It takes about 4 to 6 weeks for you to even really feel a change. So if the meds aren't really causing any side effects and it's like week 2 and you're like, I still feel the same, keep taking it. Give yourself about that 6 weeks with your doctor should be able to, should set up a follow-up for you to come in to reevaluate within that 4 to 6 weeks. You're supposed to. So if you leave that office without a follow-up, make sure you have one, because they want to make sure, you should be making sure that the medication is working and not causing any worsening issues. I've talked about bipolar disorder before, and sometimes if you're bipolar and not depressed, antidepressants aren't for you. They cause you to get worse. So if you're somebody who, let's just say, you've been down for the last 3-4 months. You've never had a manic episode, and manic means you stay up all day, all night, all week for at least a week. You do things on impulse, things that you normally wouldn't do. You do things out of character. Some people shop excessively. Some people sleep around. So you're having like these manic symptoms. We'll talk about bipolar one day this month as well. With taking the antidepressants, if you find yourself going that route where you're getting overly excited and impulsive, stop the meds and let your provider know, because patients who are bipolar, this can make you worse. And taking antidepressants, bipolar patients who take antidepressants are at a higher risk for suicide because they end up acting when they're very impulsive and their emotions are very strong. They end up acting on how they feel. So please make sure you're communicating everything that is going on with your body. Don't think, I feel like I'm getting better, I'm getting happier. If you find that it's a very drastic change, then please be seen ASAP. Okay. Again, I'm not diagnosing and treating anybody. I'm not saying anybody has bipolar disorder, but just know that antidepressants aren't good for bipolar patients. And also, if you've had a family member who has had depression or who is dealing with depression, but they're managing well with a certain medication, communicate that to your provider, because sometimes what works for a family member may work for you. And when I say first degree, I'm talking more so mom, dad, sister, brother. Not really sure grandmas and uncles and aunts, but definitely your first degree relatives. Okay. Electroconvulsive therapy. That's something y'all probably seen it, where they put like the electrodes on the scalp and they induce a seizure to try to shake the brain, or not without trying to get so technical, but they cause a seizure to try to shift the brain's impulses, I guess, back to like a normal wave. And people have reported that it works, but they don't typically do ECT therapy until they've tried every med under the sun, and this is like the last resort. So this is an option. And they, like I said, they have reported, there's some studies out there that do report that this does help. So this is an option for someone who has been through every medication, talked to therapists, and this is one of the last resorts. Okay, so switching over into suicide. Who's at risk? Everybody. I mean, you just check everybody. Everybody needs somebody to check on them. bottom line. But it has been seen in older males that they tend to commit suicide more often than anyone else. Those who are mentally unstable, they also have noted that they have access, if they have access to firearms, that is a big issue because they can tend to commit suicide as well before anyone else. I think studies have shown just like guns, men and guns, those have been the things that are linked. So please just be cautious. And what we'll get into with this next slide is warning signs. So if you have friends or family members who are talking passively about, well, I don't want to be here anymore, or thoughts of killing themselves and they're joking about it, take it seriously. Because these people, they probably are just like, well, they're not going to take me seriously anyway, so I'm just going to laugh it off. But take it seriously, because some people can't have these active or passive thoughts. And active meaning they're creating a plan. It's sad, but I've seen patients, they start they induce a car accident. I don't even know if that's the right word I'm using, but they get in car accidents to try and kill themselves. And of course, they end up admitted, and of course they're like, well, it didn't work. So be very careful. If somebody's talking about like a plan, actually have a plan, call 911. They need to be admitted and watched very, very closely. Some end up talking about how hopeless they are or worthless. You'll hear words like, I have no reason to live. They feel trapped. Some feel like they're a burden on other people. I know I've talked to some disabled patients who feel like they're a burden to their family members because they can't work, and some who are wheelchair bound, they can't get around like they used to. We have patients who are in a lot of pain, and of course we're in like this opioid crisis, so they aren't giving pain medication out like they used to. I mean, for good reasons, but some who have chronic pain, a lot of them feel like there's no other way out. So that's the only way out. If you're noticing family members or friends start to use more alcohol or smoke more cigarettes or smoke more weed just to take away the pain, you'll probably hear that saying, I just want to take away the pain. Watch them and report that, okay, to somebody. 911 is probably going to be your easiest thing. Let's see what else we got here. Oh, you have friends who usually go out, or family members who usually like to go out, and all of a sudden they're like, I'm not going out anymore. I don't feel like it. Those are key signs of depression. Okay, so please just check on you people. People are sleeping a lot. I have heard stories of family members or friends calling, saying their goodbyes, getting ready to attempt suicide. But of course, these stories, these patients have been stopped and saved. I've seen, I've worked with a lot of elderly patients, but patients that give away things, elderly patients who give away their most valuable gifts or things in their homes, things that they value, and they start giving things away. That is a key. Selling things, that's just the key to make sure you just check on them a little bit more than your, hey, how are you? Figure out what's going on. It may not be anything. It may just be they want to declutter, but just ask more than that, hey, how you doing? And just kind of bring it into a deeper level. Like, is everything really okay? And it's okay to ask that, and just, encourage people to speak out and let them know it's okay not to be okay, but just seek help. Some people have increased aggression, and some are always tired. So those are some warning signs. But I have posted here, and I'll leave this here for a second. This is the National Suicide Prevention Line. So it's always open if you have thoughts of hurting yourself, even other people. Because homicide people really do have homicidal thoughts that they really feel like they can't help or can't control. Make sure you call in this line, okay? And again, I'll leave this here. Of course, you can get on Google and type this in, and you'll be able to access it quickly. Go to the website. Okay, let's see here. These are my references. Let me go back. Making my way back to you guys now. Let's see. All right. So I'm going to look now to see if there were any questions. I hope this was beneficial. Again, my goal is not to diagnose and treat in this setting, but I just want to make sure you guys understand that these things are real. Depression is real. Suicide is real. You probably know somebody who has dealt with depression or has dealt with suicidal ideations or thoughts. But make sure you guys are reporting those things, even if it's you, report it. It's okay to be admitted to save your life. Like, it's all right. I've seen all ages admit it. So you're here for a reason, and just don't let whatever you're dealing with, that temporary feeling, just kind of take you out. Because the goal is, if once you dip down into depression, you got to be able to bounce back up. So it's all about coping mechanisms. And sometimes we're just not taught how to cope. That's just, and it could be cultural. We're just not taught how to deal with things. So a lot of people, some people run away. Some people confront things head on. It just kind of depends on how you cope. So a behavioral therapist is great. With a counselor, you can see a psychiatrist. And again, a lot of people I know now we're in like this natural, we're going through a lot of things where people want to just be strictly natural, and that's okay. But this is my thing. If you have to get on something temporarily to balance yourself out, and then you maneuver on to something more natural, do that. It's okay. Medications aren't magic. Like they don't work that way. And another thing, if you're in a stressful situation that's causing your depression, you got to get out the situation. Like you can't. Zoloft isn't gonna help. Isn't gonna help you if you having financial issues. Zoloft not gonna help you find another job. So you have to understand that some things we have to be able to change ourselves. We have to work on those things, and it does not happen overnight. That's not what I'm saying. And that's why some people need a little help just to get them motivated and get them out there, get them going. And then you start, like I said, that year is really that mark. You stay on your meds. If you're doing well for that year and you want to try to come off of them, just try to wait at least until that 13th month. You'll get a year in a day, and then talk to your provider about taping yourself off. Some people stay on the meds. It just kind of depends on who you are and how you want to manage things. But just be okay with taking something to help. I don't know about the herbals. There may be some. That's not what I'm saying. But what I'm saying is, especially if you know somebody who's dealing with a mental illness and they can't seem to get themselves together, encourage them to just go be seen and be checked out and go from there. So let me see what's in the comments. Okay. Quita, I missed it. You said your mom did. I'm sorry, I missed it. Drill, yes, vitamin D is so important. My vitamin D was 11, y'all. It's supposed to be 30. And it's like 30 to like 120. So really like 70 is where you want to be. And over-the-counter vitamin D is fine. It just kind of depends on how low it is. They do have prescription strength vitamin D. Do not let a provider tell you go take over-the-counter and your numbers are less than 20. I'm sorry. If you're under 20, you need a prescription for vitamin D to go ahead and hurry up and shoot it up so that you can start feeling better. But the vitamin D can cause a lot of other issues. Joint pain. You guys probably heard that. Just being tired all the time. Mental changes. Vitamin D is very important. So, Drell, you asked, is there any way to check this out without going to the doctor? Are you talking about just being diagnosed with depression or your vitamin D level? Let me know. Mr. Sutton, what if you don't like taking meds? What are other exercises or avenues you can do for depression? Oh, you just put me on the spot, huh? You just want me to work my brain. No, I'm teasing. Anyway, so if you don't like taking meds, my thing is, so words of affirmation are great. Speaking things into existence, that's truly what I believe in. I know everybody doesn't practice that way, but being positive all the time. And again, changing those stressors, because a lot of times, a lot of times our depressive thoughts come from things that are external. It may not be internal. It's probably your situation. And if it is your situation, you have to work on changing the situation so that your mood can change. But I would go out and do things that I know I used to like to do. You know, if I like taking walks, then I would go out and just force myself to walk. And also, you don't have to necessarily jump to meds. You can start with therapy. Therapy is always encouraged. And I know a lot of times it's like voodoo, especially in our culture, to go even see a therapist because you're quote unquote deemed crazy. It's not crazy. It's okay to talk to somebody else other than your pastor or your mom or dad. Like, go to somebody who doesn't really know you. They're going to be non-biased, non-judgmental. You're able to tell them everything that you've gone through from your childhood, which a lot of times, especially I just know for African-American culture, we carry a lot of baggage from childhood trauma. Like, I mean, we just never addressed it. So in our adulthood is now trying to be addressed. It's fighting, you know, we got, you know, what they call demons trying to fight, you know, fight and keep you down, but you have to be able to address those issues from 20 years ago. You can't sweep them under the rug, you know, we just have to talk about them. And I don't think a lot of people realize how the childhood trauma is just, granted, you try to bury it, but when you're hit with another stressor in your life, like you lose a job or a child, and everything just kind of comes back together. It's just like, it just comes back because it never really went away. You want to be able to tolerate or be able to talk about your traumas without having a breakdown or being, what's the word I'm looking for? Triggered. You know, we got to work on not being triggered. Some things just still trigger us, and it takes years to get rid. I mean, not even necessarily get rid of, but to tolerate it, to be okay with talking about it. I hope that answers your question. Hi, Miss Norma. Good evening. Thanks for joining. Okay, I might have missed Drell. I don't know if he's still on here. But I'll just, so he said any way to check this out without going to the doctor. So if you're referencing vitamin D levels, no. You have to have blood work drawn to actually know what the physical level is. Now, with that being said, you can take over-the-counter vitamin D. You can do that. And your body will, because it's just, the body's an amazing thing, it will get rid of whatever it doesn't need. I just always recommend, even if you go, so say you go this year and you don't go for another year, I just always like for patients to get a baseline. Just get all the blood work done at one time. That way you know where you stand. And then if you choose to wait another year to get it checked, then just wait another year. But I don't recommend, I mean, I'm just like for patients to know where they stand because our bodies change every year. Yes, Jason, you do have to find the source of the triggers. And like I said, sometimes you have to dig way back to age 8. Like, you know, it just is sad, but, you know, we don't really hear about therapy or counseling. So now, you know, that's why I'm out here. I'm like, I'm a young Black girl out here trying to figure it out too. So I encourage everybody, get a therapist. It's okay. Some of them real nice. Life coaches, I got one. If you want one, teach me, I'll give you your information. But let's see. Okay. Facebook user says, hey Lily, hey, I can't see your name. I'm sorry. All right, Miss Norma, you are welcome. Well, I'm not going to hold you guys up any longer. I know it's been about 30 minutes. Oh, 35 minutes. I hope this was beneficial. Please share. Again, follow me on YouTube. I hope the PowerPoint was great. It made it easier for me to discuss the topic without fumbling. So I think I'm going to do that from now on. But if you guys have any additional questions, my website's down below, the email as well. Feel free to contact me. And we will discuss anxiety next week, next Monday, the Lord's willing. Okay. Well, thank you guys for joining. I hope you guys enjoyed this. And let me know if there's any feedback, good or bad. Let me know. I like feedback because I like constructive criticism. If I need to change something up, I'll do that. All right. Well, y'all have a good rest of your evening, and thanks again.